Do you sometimes feel like this? Do you sometimes feel like your head hurts so much that you have to go into a dark room or you can't stand sounds? Does your headache occur on one side or the other, or does it occur all over your head? All of these are headaches because your head aches, and they have various causes. I have so many patients who have migraines and headaches, and they've been the medical route and they've taken all these medications and it knocks them out and they feel terrible and it doesn't really help. I want to be able to help more people with their migraines and headaches because they're not necessary. Hi everybody, I'm Dr. Lisa Gordon. I'm here at the Natural Health Improvement Center of Columbia, Maryland. So, migraines can be caused by blood vessels that are constricting. That could occur because of something you ate, or because you're anxious, or it could happen because you didn't sleep enough. There are various reasons, and migraines are not very well understood. They often happen with hormonal shifts, like when you have your period or you're about to get your period. You could have a migraine that lasts for days. And I have several patients who come in and they say, oh, I have migraines. They're still going to work, but they have a migraine that lasts 3 days every single week. This is not acceptable to me at all. I don't want you having migraines. It's not necessary. Other reasons for headaches could be sinus problems. Maybe you have allergies that you haven't handled, that you're just taking medication for, and again, it's knocking you out, or you don't feel well, or it's making you hyper, or you don't feel like yourself when you have the allergies, and you don't feel like yourself when you take the medication. So either way, you need a different solution. So what's the solution? I want to introduce you to my friend Esperanza. Esperanza in Spanish means hope, and you can have hope. So you don't have to have these debilitating or annoying headaches. Headaches are not normal. A lot of people say, oh, I have normal headaches. Headaches are not normal. So what I want to do is figure out on each of my patients, and all of my colleagues who do this kind of work want to figure out on their patients what's causing your headaches and what can we do about it. Is it something that you ate? Do we need to figure out whether you have some food sensitivities so that we can either correct them, or you can avoid those foods until they are corrected? Do you have a problem with your liver perhaps? Maybe your liver isn't handling toxins in your environment as well as it could, and so you end up with a headache or any number of other symptoms, even skin issues. If your liver isn't handling toxins, you could end up with a skin rash, because your skin is the second most important detoxifying organ and the largest detoxifying organ that you have. So a lot of my patients come in and they say, oh my gosh, I have this acne, I have these headaches, I have menstrual cramps. What can I do, doc? Do I need a medication for each one? You know what, you guys, that doesn't even make sense to me. It doesn't even make sense. Let's take a body that's supposed to be functioning at 100% and get it to closer to 100% so that the symptoms, the headaches, any symptom doesn't need to be there to scream at you. That's what symptoms are, including headaches. So we've got to find out what organ dysfunctions are going on, what nutritional deficiencies are happening, what structural issues are occurring. Are the bones of the skull perhaps out of alignment? Are the muscles that are in the neck, is the neck out of alignment? Are the muscles too tight? All of these can occur, and you actually have muscles all over your head, and you've got tissue inside your skull called the dura mater that we work on with neurocranial integration. There's so much that can happen if we figure out what's going on in an individual person that's causing their migraines and headaches or any other symptom. So please share this video. Practitioners all who do chiropractic, who do nutrition response testing, who do advanced allergy therapeutics, all these things I do in my office, and there are people who do some of these in various parts of the country. So if you're not here, if I can't work with you, please let me know and I'll be happy to refer you to somebody who hopefully in your area who can. So please do share this video. You might save a life.